My name is Jean-Marie Cook, and I'll be discussing nursemaid's elbow, or subluxation of the radial head. This is a partial dislocation in which contact between the joints actually remains intact. It can occasionally occur as a high force injury in adults, but it is typically a pediatric diagnosis. It is most commonly seen in children who are less than 5 years old. In instances of nursemaid's elbow, what happens is that the annular ligament actually slips out of its standard position around the radial head and becomes lodged between the radius and the ulna. Common causes of this injury include a forceful upward jerking of a child's arm by a caregiver, say when a child stumbles and goes to fall, or if they're playing and swinging. This typically does not occur as a result of a fall. It does not typically cause a deformity or swelling. Children are at an increased risk when they're at a younger age because their radial head is not as large or bulbous as those of older children or adults. And this is important because that larger radial head provides a greater barrier against the annular ligament so that it can't slip over as easily. That is why there's a decreased instance of this type of injury as children age. Other factors that increase their risk include a previous subluxation if they've had it before, or if they have ligamentous laxity, which can be due to a muscle strain or a repetitive motion injury. Three things that you should essentially ask during the workup are: number one, how did the injury occur? This is particularly important because the mechanism of injury can strongly indicate a nursemaid's elbow injury. You should expect to hear a report of some type of pulling injury as we described previously. Number two, did your child cry out or report pain at the time of injury? This is important because children often will cry out if something hurts, but what happens in this particular instance is that they'll instinctively find a comfortable position for their arm. They will slightly extend it and pronate it and kind of hold it to themselves, and this is not painful, and so they won't continue to complain of pain, and the parents think that they're fine and don't look any further for a significant cause of injury. Number three, has your child used his or her affected arm since the incident? As I said, they'll find a comfortable position, which is typically close to their body, extended slightly, pronated, and they won't move it because they understand as soon as they move it, it hurts more, so they just don't move it. Let's see, top three physical exam components that should be performed in your assessment include inspection for ecchymosis or swelling that might suggest a fracture versus nursemaid's elbow, because you definitely want to rule that out. Children will keep their affected hand extended, pronated, and refuse to use it, keeping it in that more comfortable, safe position that they have found that totally works for them and they're not moving out of it. Number two, you're going to palpate, and you're going to find most often that they'll be tender over the radial head. You'll also be assessing their brachial and radial pulses and sensation in the extremity when you do this, but there's typically no deficit in those areas for nursemaid's elbow. Finally, you can attempt range of motion testing on the affected elbow, but odds are this child who's been compliant and docile will cry out as soon as you start to move that elbow. So that is a typical finding. The most common treatment for nursemaid's elbow is to reduce it. You have to put that subluxed radial head back into its proper position. This is accomplished by applying pressure over the radial head while rotating the hand and forearm to a supinated position until you feel a click along the lateral aspect of the elbow. If this does not occur with the initial attempt, you may need to pull on the forearm, that is, apply longitudinal traction as you perform the maneuver again, hopefully this time feeling that click on the lateral aspect. This maneuver will assist the annular ligament in dislodging from between the radius and ulna and returning to its standard position. Children will most likely feel some discomfort initially, but as soon as the radial head is back in place, they say that they feel as good or better than before everything got started. They typically have usual use of their extremity within 5 to 10 minutes of the reduction without the need for a sling or splinting. Three priority teaching components for the parents and the child are that you should inform them they're at an increased risk. Now that they've had a subluxation, they're at higher risk for a repeat subluxation. They should avoid lifting or pulling the child by the arms or the hands. Two, parents may administer Motrin or Tylenol or apply ice for any minor discomfort, but as I said, pain typically resolves with reduction. And finally, advise the child and parents to take care with physical activities such as monkey bars, because these activities increase their risk of recurrence. Thank you for your time.